How important is design and the role of design in the app that you develop? And also, Michael, I want to ask you the same in the applications you develop. And knowing that you have to hit a large range of folks across multiple different devices, levels of tech savvy, experience with other applications, and you need to continuously iterate. What is the role of design? Can you speak a little bit to the design process at all?
Yeah, and I know Michael can add to this, but so on the software side, we do a lot. So we're doing extensive UI, UX design with some world-class experts. Then we do all this extensive human factors testing. As a matter of fact, we're required to do it for the FDA for our filings to make sure people can use it safely and effectively from one device to the other, from one patient type to the other. But we go beyond what's required just to make sure we're delivering a great user experience to the patients that are using it. But it's more than just the software, it's actually the total service delivery. So you know, some patients might have an iPhone and they've never even used iTunes. We can help them, we walk them through it. So we offer 3 forms of training. So on day 1, you can do a virtual training, you can have a remote training. We'll actually have a clinical educator that's trained to help you start this product over the phone or over a WebEx, or we will sit down with you in person and we'll hold your hand. And you know, again, we've been surprised. You know, the 80-year-old comes with their iPad Mini. Oh yeah, I'm ready to go. And you know, a 42-year-old just has never really even used a smartphone in any way. So and then we also have 800 number customer care. So you know, we don't say, hey, if you got any problems, good luck, or call your doctor. That's the last thing they want to hear. Call 1-800-BLUE-STAR, and you know, we'll help you. We'll triage it. If it's medical, we'll route you back to your doctor. Every product you make, you have to design for the user to find their own experience.
We had Adam Dole, who was at the time a White House fellow, but now he's got his own startup going, and he spoke about the big D design and thinking about how the systems all need to integrate and you know, the various users, but then also all the other stakeholders. In the games you design, obviously there's actual design of the software, to Chris's point, but how do you think about the design of the whole ecosystem and all the various folks who might be involved? I know earlier today we were talking about social games that involve people from across the country and you know, things like that. How do you look at the larger picture of design?
People make healthcare decisions, make choices about how they're going to behave, what foods they're going to eat, you know, whether or not they're going to get up and walk to their medicine cabinet and get out their medication in some particular context. And you have to design for the context that they're in. You can't design for some theoretical context or you know, some ideal state that never exists in reality. I mean, you have to integrate it into the person's life, and that's been really our learning. I mean, you know, we kind of come from the game industry, many of us, right? And no game studio is going to make a game that a person is going to play on a device they don't own, right? I mean, these are the sorts of things that just come naturally when you're one step removed from the dollar arriving in your bank account, right? Bringing some of that discipline to these healthcare applications, I mean, it seems funny to say that we're bringing discipline from the game industry into healthcare, but I think it's really true that we think a lot about what people's emotional states are at the time when they're interacting with the thing. What is it that they need to be feeling right now, and what is it they need to be doing, and what background data do they need to have, and who else do they need access to, and how can we make this thing maximally useful in the context in which it is delivered? And so we like to say, you know, people are, you know, we've built websites or deployed them, and maybe you've got a content management system. We like to say our software is a context management system. We are always trying to be maximally aware of the context that the person is in so that we can deliver them the right tools and scenarios to get to their objective.
And from a medical and neuroscientific point of view, what these states that people are in when they're interacting with these games that you're talking about actually affect their brain chemistry.
Yeah, absolutely.
The brain chemistry actually changes based on what kind of emotional
and
physical state
they're in. Very true. I like to say that the game industry is, you know, as a whole industry's job is to sell you back your own brain chemistry. You know, and so, you know, that's a responsibility that we take pretty seriously. When you're manipulating states of somebody's brain, you need to be thinking very carefully. I mean, it's one thing to make a game that nobody likes to play, and it's another thing to screw up somebody's diabetes regimen.
Eldar, you had actually said something around designing around inattentiveness for better outcomes. The notion of having to opt out of a savings plan versus opting into a savings plan. I believe you even ran a study on coupons at the point of purchase that actually put money in your savings account. You speak to that notion of design and designing around behavior?
Thank you, because that's exactly where I wanted to go. So extending on Michael's point about the context, I just want to remind us that we think of design as something that has to do with software and machines. But I think everyday policy for behavior change could be designed in ways that are nothing like that. So you can design a cafeteria, what food people take earlier to fill up their plates, and a menu, and all kinds of things like this. You could design copays, which have an enormous implication, unfortunately, for people's willingness to go to the doctor. In India, they've designed financial instruments that allow farmers to buy fertilizer ahead of time when they have liquidity, as opposed to at the right time when they're out of cash, with an enormous impact on their income. So these are all designs that have nothing to do with machinery. They're just clever interventions at the right moment. The most generous benefits program in the US today is probably FAFSA, which is money that the government gives you to go to college. Take-up is crazy low. It's like 30% of eligibles. This is an impact on your lifetime, earnings, education. And things they've tried now is, if you look at the FAFSA form, it's 18 pages, and it's written in a fashion that nobody in this room can understand. And then it reminds you on page 15 that you're answering under the penalty of perjury, and the whole thing is a disaster. And what they do is they take this form and they say to you, I know everything about you, Sharon. I know that you're entitled to $4,000 a year or $40,000 a year. Here's the form, do it. And people don't do it. And then you do the same thing and say, I know you're entitled to $40,000 a year. Here's the form, let's fill it out together. Now that is $10 an hour. And it changes people's actual matriculation in college. So that's a design. It's a design that says, no cost-benefit analysis would tell you that if you offer me something that's worth $100,000, I won't do it because I have to fill out a form. I mean, how much is my hour worth? 10 hours, 20 hours, it never makes sense. Instead, there is something about this bandwidth and leaving it for another day when my sister comes and helps me or whatever, and life goes by. And this design thing of having somebody at $10 and a minimum wage helping you do it, changes your life.